Welcome to the Patient Voice and Linguistic Validation Café podcast, a place to gather, connect, learn, and grow together by creating community, embracing our cultures, and sharing our passion for patient voice research and linguistic validation. This is the space and time we take to embrace diversity and discuss how to improve the human aspects of health communication, clinical outcome assessment science, and medical translation. This is episode 12, part 2 on our Women's Voices series. Listening to Women, Voices, Validation and Change in Healthcare. Exploring empathy, gender sensitivity, and advocacy through personal stories of women's health and care. With our special guests, Leticia Daniels, Miriam Santos Freire, and Talita Domiciano, and our co-host, Mark Gibson. I am your host, Ferrante, and this is the Patient Voice and Linguistic Validation Café.
This episode is sponsored by GRC, putting the patient at the heart of research globally.
Well, hello everyone, and welcome to another episode of our Patient Voice and Linguistic Validation Café. This is episode 12, and it's called Listening to Women, Voices, Validation and Change in Healthcare. And we're going to be focusing on exploring empathy, gender sensitivity, and advocacy through personal stories of women's health and care. And for this, we have as a special guest, Leticia Daniels from GRC. Thank you for being here and accepting our invitation, Leti. Miriam Santos Freire, thank you so much for being here. You are a patient advocate for sickle cell syndrome, and you'll tell us a lot about it. So thank you for this. And then Talita Domiciano, welcome. And Talita, you're a pharmacist and also linguistic validation consultant, and well, you're going to share your experience as well, which is very enriching for all of us. And lastly, happy to have you, Mark, as always, my co-host. Welcome again. And today this episode is a bit special because I'm going to move myself to the position of guest as well, because I fit the profile of women and patient. And today Mark is going to be hosting this episode. So thank you so much, Mark, for taking care of this and for listening to us as women, patients, and linguists as well. And as always, thank you so much for our community members who are here today and who will also contribute either through the chat or directly through asking questions and sharing their experiences as well. So I'm going to invite each of you to just introduce yourselves a bit so that people watching us may know who you are. Leti, would you care to go first and share a bit about your life?
Yeah, thank you for having me again. So I am Leticia Daniels. I work as Director of Resourcing with Mark and Noor in Gibson Research Consultancy. And here I am today as a patient because I have been living with diabetes type 1 since I was 12 years old. So it has been a long journey for more than 30 years, when I have experienced a lot of happy moments, a lot of success and everything, but a lot of struggles also as a patient. So here I am today, and I would be happy to share my personal experience through all of these years.
Thank you so much. You are based in Guatemala. I forgot to ask you to share with us. Yes, yes. So,
thank you.
And you woke up very early today for joining us, so thank you.
Thank you.
Miriam, would you like to go next?
Okay, thank you. I'm also very pleased to be here. Thank you very much. I am not necessarily with a specific order. So I am a patient with sickle cell disease, so the most severe form, let's call it. It's a red blood cell disorder, genetic, and I'm also a patient advocate, and I'm a translator. I don't know, for many years I've been a translator, mainly in the IT sphere, and then moved a bit to marketing and fintech. And I started with medical translation through volunteering. Don't have a lot of professional experience, and more recently, because I come from language quality and cultural adaptation is something that fascinates me. I came across linguistic validation, and I completed the course with Noor very recently. So it's a brand new area. And I was very happy to, in a linguistic cafe a few months ago, to run into Mark and find out about the patient voice research, because it's something that aligns perfectly with my more recent, let's say, journey. And that's something where I want to be. And yeah, I live in Cambridge, in the UK. I've been in the UK for 11 years almost, but I was born in Angola and lived most of my life in Portugal, and still have part of a life in Portugal, go there very frequently. I'm part of a patient association, a lot of stuff. So you can find more later. Thank you.
Lovely. Thank you so much, Miriam. Talita, tell us.
Hi, thank you. Thank you for having me. So I live in Brazil. I am a pharmacist, and I studied to be a researcher for many years. I did master's and PhD here, but I ended up not in the academia. While I was transitioning to the academia, I was diagnosed with endometriosis, and that make a lot of sense in my life because I struggled a lot with the routine, with pain, and a lot of things. And I always felt underestimated as a woman, and because I suffered a lot of these things. But then when I transitioned to the industry, to the pharmaceutical industry, I started doing translation, and I had the opportunity to work closely with clinical research and with the novelties. And I ended up doing Noor's course about linguistic validation. And then I really found myself because I could join my passions of doing research and communicating with patients and making a difference in patients' lives. I had the opportunity to listen to patients and make a difference and understand them and develop things that would really help them way more than in the basic research that I was doing. So I am very happy today to use my background, my expertise to help improve patients' life and give them voice to their symptoms and to their feelings, to their lives. And instead of the traditional medicine that is only used to look to tests and exams and numbers, and believe that only these numbers are scientific, so the voice of the patients, their symptoms, their feelings are as scientific and as important as all the other parts of the science.
Lovely. Thank you. Thank you so much, really, for sharing. Well, lastly, I'm going to turn it towards myself because in this case I'm the and now I'll pass it on to you, Mark. Well, in my case as guest, well, I was a physiotherapy and a physiotherapist and osteopath and energy healer, and I had my private practice, and I was also a philologist, English philologist, and I've always translated and do both things in parallel. But then let's say I became a multiple sclerosis patient, and I'm from Spain and I live in Spain, and I had to just make a decision and close my clinical practice and just focus on translation, because that's what I could do. And then I had been doing linguistic validation for a while, and it became my focus because it could fuse or blend my passion for taking care of patients with my passion for languages and for cultures. So yeah, I guess it was, well, maybe sometimes illnesses are like a curse, but other times we feel them also like a blessing. And for me, I have ended up feeling that it's been a blessing in my life. And yeah, I all of this, I guess, wouldn't have been possible if MS wouldn't be accompanying me. So it has made me realize that I'm like, maybe it has made me more compassionate and appreciate patient voice research in a way that I couldn't have imagined before. And I really love what I do. So yeah, I'm happy to be here today to share also my experience in any way possible. So thank you, Mark, for the invitation for this, which was your idea. Oh, and I want to say something before. Mark has published, well, he has his articles, right? He publishes them in his website, but also on LinkedIn. And the one from today, well, it's really to the point, carrying fire. You know, it's called Voices Entrusted. And I love that, no? How we carry the fire, how we listen, if we listen to patients and not, as you were saying, Talita, not numbers or test results, but really it's kind of an oral tradition what we're doing by sharing our experiences and our voices here. So we really appreciate it, Mark. This article that anyone, you know, if interested, we will add it to the description later on, and you can read it. Carrying Fire, Voices Entrusted. Okay, now to you, Mark.
I just want to say something about those articles. They first started off just as fun articles that our colleague Alejandra Contreras and I were working on in New York. Letty wasn't invited to that trip. And it coincided with Easter 2024. And, you know, we're both interested in the Bible and that kind of thing. And we are also interested in the shift between oral to written, and now that we're going to a post-literate society to oral again. So it's almost like we're going full circle. And we had pinpointed that maybe Moses writing the Ten Commandments was the metaphor in the Judeo-Christian tradition of pinpointing that transition from oral to written. And so it was just some fun articles, and then I got carried away. I buried them for about a year, and this Easter I picked it up again. Probably watched Exodus or something on TV, the Charlton Heston movie with the flight of the Israelites, and then I started going further into orality and the importance of it and the importance of the voice of that. And I thought, well, you know, it is, you know, patient voice is definitely part of that. And so they weren't intended to be serious articles, but I think there's potentially a serious point there. And the second thing that we forgot to mention, that this is actually the second part of a webinar about women's health.
Right.
The first one was just so vast that we didn't even cover, I don't know, 10% of what we wanted to cover. And we got onto, we were starting to get onto just the need for listening for within, you know, when you present in symptoms, it goes for males, it goes for females. We need to be listened to, and listening and empathy are the two key most important ingredients in patient voice research. You've got to be able to listen, and you have to have some modicum of empathy, otherwise you can't do it. And I wanted to just open that to discuss what are your experiences in terms of healthcare professionals listening to your concerns. It's a big question.
I guess I feel comfortable starting this. So as a pharmacist, as a healthcare provider, I was always in love of taking care of myself. And since I was young, I took care of my health, going to the gynecologist, and it seemed that professional was very competent. He was a professor of the university. He seemed to be listening to me, but every time I complain about my cramps, my colics, and my intestine, he would say, well, that's normal. That's for being a human. And then other symptoms became to arise, like anxiety, like symptoms were getting worse. And I always heard, no, that's just being a woman. That's normal. Oh, just don't get so nervous about your wedding dress. Don't get so nervous about your research. Women are too nervous about everything all the time. And I got used to hearing that. And I was going to other doctors to treat my other problems. For example, I always had irritable bowel syndrome. So that was a huge problem in my life. And I tried different doctors, different medications, and it all ended up the fault being on myself. Oh, you have this problem with your intestine because you don't eat well. You're not eating well. Oh, you're eating now too much lactose. Oh, you must have gluten problems. And I did all the tests, all the numbers, all came negative, and I took all the medicines and never improved, never improved. And then I started to have real hard crisis of pain that took me to the hospital. And at one point I came into the hospital like very painful, and a woman doctor that was supposed to listen to me and get worried about it, she just gave me a simple medicine and discharged me without asking me if I had improved. And then she was she switched from her on call, and the next doctor came, and I went to talk to this other doctor, say, I'm feeling no better. And she said, how come? And then this one listened to me. How come are you feeling no better? I'm feeling worse than I got here. And then this doctor looked at me. I felt looked by this doctor. And she ran every scan that she could. And she said, well, are you pregnant? I said, I'm not pregnant, I'm sure. And she said, well, at this point, I have to doubt you just to be sure that I'm giving you the best care. So I'll run a pregnancy test. And she did every test, and she finally saw something in my intestine. And when she suspected of Crohn's disease. At that point, I felt relieved, because it's been like years searching for something, and everybody was saying, you're normal. That's normal. That's being a woman. And I was feeling, I'm crazy. I must be crazy. I must be like super reactive. I'm not worth trust, because I don't know how to deal with pain. So something so simple. And then I started investigating, and I did the colonoscopy, and the doctor came so happy. Your intestine is beautiful. It's perfect. And I felt like very bad again. I said, no, I wanted a diagnose. And then he referred me back to the gynecologist. And luckily, my gynecologist, that one that seemed to be listening to me, he was unavailable. He had his surgery, and I was attended by a friend of his. And when this friend looked at my exams and looked at what I had to say to the kind of pain that I was describing, he immediately suspected endometriosis. And then he sent me to do a specific test that was actually very simple, an ultrasound with cleaning bowel with a specialist. Nothing very fancy, nothing very expensive, but he just go and do this with this specialist, and we're gonna know if it's it. But I think it is, because he heard me, he heard my pain, he heard my history. And then I had a diagnosis, and then I started getting the proper treatment. But listen, all this story that I told you, it was over 10 years being, like, much more than 10 years since the first time I got menstruated, being dismissed by doctors, at all kind of doctors, being dismissed at work because, oh, you have headaches all the time. Oh, your mood is not good today. Oh, you have to go to the bathroom all the time. So I've had a very low self-esteem because of it. And then after I got treated, I started to have chronic pain, even after I had surgery. And then it was a new start of searching for doctors that I could really treat the pain, because the ones that it was something new for the doctors that endometriosis would cause neuropathic pain and chronic pain, and they didn't really know how to treat it. They would just shut up the hormones, and that's it, shut up and be quiet. Well, but I have my hormones shut up and I still have pain. Well, let's start going to all the drugs. And at the end of the day, I had to research some treatments myself, because I can, because I have access to the scientific publication. And I started wondering, oh my God, what about people who don't have access to that, who can't be skeptical about they are being told? And the doctor will tell you that they have a irritable bowel syndrome because they are eating milk, and they have to be private of eating milk and cheese and a lot of foods. They will have a shitful life because they cannot eat everything everywhere with their family, with their friends. And that's wrong. How will they criticize or ask the doctor, who is the authority? So this made me feel the urge to start advocating for women in this sense. Well, you have to question your doctor. You have to search for the expertise of your doctor. You don't accept anything. You have to test yourself, and don't simply accept anything, because it's your health. And if you don't make your voice heard, they will not do it just because they are doctors.
How many how many health professionals did you go through before you got that diagnosis of endometriosis, if you could estimate that?
About 6 just for endometriosis.
Right.
About 6, and without mentioning the gastroenterologists that could have suspected. Because when you the symptoms are, now that I know, that are very clear. If you haven't irritable bowel syndrome, you have to investigate endometriosis, because it's cyclic. Your intestine will get worse just before getting menstruated. So when someone complains about it, send them to the gynecologist, do a simple exam, just do it.
And I think, I'm not a health professional, but looking in at your situation, a lot of people would think that you were just, there's the knowledge gap between the doctor and the patient. that knowledge gap is not there in your case. And so from looking at from the outside, you would think that you had better access than the average patient in terms of
Yeah, sure.
going for it. Like, for example, the average patient wouldn't be able to look at different treatments and understand it. They might listen to some idiot on a podcast, not this type of podcast, but you know what type of the manosphere.
Instagram.
Yeah, that kind of thing. I dug myself in a hole there. Sorry, but you know what I mean, though. People might wouldn't have the critical thinking that you have in terms of treatment options.
And I was a victim of these poor options as well. So I wore those shoes when I did the surgery, and I gained a lot of weight because I had pain and I couldn't move. So I went to a nutritionist, and the nutritionist said, well, um, lactose causes inflammation, and endometriosis is inflammation. So you have to reduce inflammation through your body. And she cut everything from my diet, just literally everything. And as a result, in 2 weeks, I had a panic attack crisis at the restaurant. So she had good intentions, but she was poorly informated because it was not widely distributed, the information. Now that I have studied and see the importance of learning about my disease, so I'm not victim of poorly informated professionals. So, and then you will find a lot of information online, which the normal people will not know how to judge who is an expert and who is really an expert, because they put themselves in their role of, I can provide you a natural cure without hormones, because hormones are bad for women. Women should not have hormones because hormones will cause you cancer, and we are afraid of cancer. We're very much afraid of cancer. So let's go to the natural way. So to the diet. The diet is the main thing you have to take care. And we go there and we feel, oh, I'm a fraud, I am a failure because I was not able to control my own diet, and I am sick because of myself. And it's all a lie that we hear. And then I started to understand that I could not rely on the public health system. I cannot rely in the private health system, the insurance, because the insurances, they not pay well the doctors, and the doctors will do just average work. So in order to take the best care, I had to choose the doctors, to research about the doctors. Well, I'll go not to any gynecologist. I have to go to a specialist in endometriosis, and I have to pay for the knowledge of this person. And then I was able to receive a appropriate care. But I know that it's not affordable for everyone. So this is where I think the voice, given voice to the patient, is so important. The patient has to understand, has to be educated to the point that he is the center of the medical care, because without the patient, there is no need of medical care. So the information that the patient brings is the most important information, is the symptoms. Because if you treat something that doesn't improve the symptoms, it doesn't translate to an improved outcome, it's not worth treating. So, for example, a biomarker for endometriosis is CA125. This biomarker was never altered in my case, never. So if they just ran a test, they would never suspect of endometriosis. And then now I know the symptoms, and they are so clear. I just talk to my friend and I say, well, you have these 3 symptoms, and it's, for me, it's obvious that you have something gynecological, maybe endometriosis or polycystic syndrome. So go ask your doctor about it, and ask to do this exam, which is simple and affordable. Ask for it. And then the patient will know that they need to be heard at only this point. And from that on, the doctor will just like open their eyes. So that's a kind of work that needs to be done, in my opinion.
And what about other situations? For example, I know that Letty, you went through all of this diagnosis as a child.
I'm sorry. Yes, I was thinking about that while listening to Talita, because I was thinking you have to put the patient in the center of all the research, of all the healthcare profession, the healthcare system. But what happens when you are a child? For example, in my experience, the first time that I received a diagnosis, I was 12 years old. And I remember my doctor was there sitting in front of me, telling me things like, don't cry, you will be sick for all of your life. You will have to handle this. And, you know, as a girl, a little girl, I was just trying to process everything. And how can you raise a child's patient voice when you are that little, you know? How to empower that, you know? It was really difficult. Of course, my parents were there for me, but as a patient, you have not many things to say, you know, as a child. So how can we improve that aspect, for example? Because now we are all women, we are grown up, we can stand in front of a doctor and tell them, I feel this, I think that, I made my own research, you know. But as a children, how can we really listen to them?
Yeah, I mean, I'm as you, I know your family really well, and your parents, I know, really fought for you, and although they're not health professionals, their level of health literacy is really high, and they did a lot of self-study. And I just wonder, not all parents would do that or could do that.
Mhm. Yes, and for example, I have always rely on the fact that my doctor at that moment, she was very young, you know. She was probably 27, 28 years old. And I think that I was one of her first patients, but that doesn't take away the fact that as a patient, her words really made a huge impact in my life, you know. And then it comes the emotional aspect, because someday I read something that says, how is possible that for patients receiving a serious diagnosis, there is no psychologist, for example, next to you, helping you, like, through this change in life, you know, you are dealing with. So yes, there are a lot of things that we as a patient can provide, you know, our insights, our feedback, and there is a lot of work, I think, for a lot of healthcare professionals to improve their communication, their empathy, you know, to the patient, and not just see you like as you are one more number, but you are a person, you have a history, you have a purpose, so to be seen, really.
And Miriam, if going back to listening and at the beginning of diagnosis, was you mentioned sickle cell? Was that diagnosed from birth or early infancy?
So it's a genetic condition, but the knowledge about sickle cell is, I would say, fairly recent. Not very recent, but fairly recent, especially in Europe or the Western countries. So I was born in Angola, as I said, and I was diagnosed when I was about 18 months old. My blood went to Canada, South Africa, and the UK for tests, and all three agreed that it was sickle cell. My parents received the news not so happily, as you can imagine. They ran a test on the whole family, and I was the one with the disease. So both my parents are carriers, and that's how it needs to be. my two elder sisters don't have anything, and my brother, so third in line, also a carrier, and I was the one with the full package. Okay, so first thing is that don't worry, because life expectancy for her will be about 5 to 6 year olds. That was the big bombshell. And then what do you do? So there we had, fortunately, doctors in the family, and they said, okay, we're going to do the best and find out where there is information about it. So a lot of communication started with the UK mainly because it was easier, the communication, and finding whoever else knew about it a bit more. And then, so we lived in Angola. The political situation started to get a bit very unsettled. And the decision was to come to Portugal because there was a recommendation to move to a milder country where the weather was more controlled. So not so damp, not so hot, not very cold. It would be southern France or Portugal, and we had relatives in Portugal, a grandparent in Portugal, and so we came back to Portugal. And so at the time, Angola was Portuguese territory, so I always had the Portuguese nationality. And I grew up mainly always with a very good communication between the public health care system and the private healthcare system, because the knowledge was mainly, unfortunately, in specialists, exactly as Talita said, that you need to find where the specialists are and do specific exams and so on. So it was a very expensive route, always side by side with the public system, because when the time came for hospitalizations, and there were quite a few, and everything, it would have to be public. So there are a lot of flaws in the public health system, but it works and it has great specialists, but often is not the only possible solution if you really want to find a way to go. So that's how it was. The diagnosis, I agree, and speaking to a lot of people with rare diseases is the key point. And the earlier you have it, the better, because then you will at least know, what do I need to go? If you are interested in, I believe that information is power. And so I'm all for speaking up, knowing more, finding out more. A lot of it is in English, unfortunately, because you really need to develop proficiency in English. And if you don't, it's difficult. And there is a lot that it is up to the patient and the patient family to do, and then to ask for a second opinion, a third opinion, and to try different approaches. Some will work, some will not work. So it's a difficult route. I also agree with Leticia about the support, which is essential, because usually if you are a cancer patient, at least in the latest years, you have a lot of support, but there are other diseases that can also be life-threatening, which also have a very heavy toll on mental health, and there is no support. And that is essential for the family, for the patient. It's essential. And I'll leave the floor if you want. I took more notes about along the way, but I believe that Noor also has an important testimony. So maybe we will be back to it later. Okay? Yeah. Thank you.
Yep.
Well, I really feel very moved by your stories, really, and very grateful. In my case, well, in relation to be listened to, well, maybe my situation is more special because I'm a healthcare professional. So in the case of MS, let's say, since I started in my career, I realized when I got to the part of multiple sclerosis, I thought, oh my God, maybe I have this, because it coincided with many symptoms I had. I was in my early 20s. But I just thought, well, this must be stress or something, or I cannot be diagnosing myself. This doesn't make any sense. So I recognized that the first person who didn't listen to me was me. I didn't listen to me. And well, it took me 20 years to listen to me until my body just screamed. And really, I got a very, very intense flare of MS, and I had to be hospitalized. And there is when they diagnosed me. And while they were doing that, I was saying, I know it's a mess. I know it's a mess. Not because I think I know more than anyone, just it was a a clear knowing. So when they gave me the diagnosis, it was just a confirmation of something I had known for 20 years, but done nothing about. I listen to all my patients, but I don't listen to myself I didn't listen to myself as patient for a long time. And then it took me a long time to start learning how to listen to myself, how to really give myself that space. And what happened is that, well, they gave me some choices for medications, and I said, well, I'm going to be researching the options. And the neurologist treating me then in a very, let's say, high level research unit of MS in that hospital, internationally recognized and everything. But he said, no, it's better that you don't look up anything, on the internet or anywhere, that you don't research anything. And I said, but why? I need to read everything and see what I can do and what alternatives I have. Of course, I come from the alternative medicine. And so I was thinking immediately, what natural remedies I can find, what energy healing I can find. Also, what did I do in terms of emotions and trauma that I haven't processed? My brain just started like going crazy trying to see solutions while I was there laid down. But the doctor's telling me that I shouldn't be looking at anything, and I just couldn't believe it.
What was the motivation for that? For that piece of advice?
Well, here in Spain, it's like they don't want you to look at things because, there's so much misinformation that maybe, you get ideas that are wrong, or you just over worry, or maybe you could just come up with too many questions that are uncomfortable. It may be a whole bunch of that. And then, well, I decided for one of the treatments, which was the least chronic, and it would entail just 2 years of treatment, and then there was nothing else necessary. So I gave it a try, but it was a kind of chemotherapy, and it was terrible for me. I had another flare, and I had to be hospitalized again. And well, while all that happened, I was in bed, bedridden, and I stayed for 2 years.
Mm-hmm.
And I remember that after the first flare, where this doctor said that, and they decided, I decided on the treatment, and they started the treatment. I said, well, what can I do? Where should I go? They didn't, I don't know, send me to physiotherapy, to a psychologist, to anything. And he said, no, you can climb mountains if you want. And I was just amazed. I was in a wheelchair. I couldn't almost move. And I couldn't believe that man was telling me that. And he said, no, that's fine. Your flare is gone, and it's controlled now. And you just keep living your life. And then you take the medication, and that's it. And my body was burning. I was in hell of a pain. My brain didn't work. I had cognitive impairment. I just really couldn't believe it. And well, I couldn't even walk. I could walk, but it was so tiresome. I mean, I was so exhausted that I couldn't walk. So that's why I was sitting most of the time and in bed. And then every time I went to the consultation room, in the follow-ups and everything, they never listened to me, because my okay, the MS, they call it the condition of the 1,000 faces, because each of us are affected in different places. So the way that the illness expresses itself is different. But in my case, my sensitivity is more affected than my motor part. So they just kept doing tests for motor abilities and everything. And I was saying, no, I can move. Okay. It's just that I have photosensitivity, no audio sensitivity. My body burns as if I was being burnt at a stake. I have a lot of pain. I feel this and that, and they would just not explore that. They would just say, yeah, okay, yeah. But I wasn't listened to at all, and I was trying to get some answers or something, and well, what happened is that I was left with any options, because also I had chemical sensitivity, so any treatment for symptoms that they tried to give me would leave me worse. So my choice was just to try to find solutions on my own, and then I decided not to take any more treatments with them, and then they were like threatening me or scaring me, saying, but that may be time of brain, or like you are like damaging your brain, and your brain is going to last less because you are not. But the treatments they offer, they are not for curing you. They are just trying to stop you from having flares and then symptomatic. But in my case, they didn't work, and they just didn't listen to me. And I explained to them, I'm a physiotherapist, I'm an osteopath, I have all these alternatives, I would like to take this and that. What do you think? And they wouldn't say anything. So I've been for years on my own, really, and being my own doctor, and then with other alternative medicine doctors. And well, now I'm great compared to that, but really my experience is that I couldn't find any help, just regular MRIs to get everything under control, and blood work, and that's all.
That from the conversations we've had, and I have an interest in alternative medicines just as a phenomenon, really. Just why people would go down that route rather than the traditional biomedical route, and it seems to me that really well. Whereas I think other people, again, people with lower health literacy, which is most people actually, might have made some mistakes, and caused themselves harm. Would you agree with that?
Oh yeah, I mean, I had to be my own guinea pig, and some of the treatments I took, even though I was informed, were not good for me. But I had to try them out because I just didn't have any other alternative. But curiously, there is a doctor, I don't know her name now. She's an MD, and she's got multiple sclerosis, and she was in a wheelchair, but in a wheelchair, almost absolutely paralyzed. And she started to research and be her own guinea pig with everything, and risking whatever, because she said, I don't care, I can't get worse. I mean, the next thing is dying, so I'm going to give it a try.
Mm.
And she took the path of functional medicine, the North American alternative medicine, but it's really doctors who were doing it. So it's an alternative medicine that is very deeply researched. And she just got out of her wheelchair. She just gives lectures over the world, and she has helped thousands of MS patients. So in my case, yes, it's because I was already, an integrative medicine practitioner. So for me, the tendency towards that was easier. But in truth, that's what I feel, that we are left with, we are not listened to, and then we have to find ourselves the solutions. And if not, in truth, my practice, almost 90% of my practice was patients who were just like me, people who just were desperate, not knowing what to do anymore. And and coming to osteopathy and energy healing and integrative medicine, and it worked, and it works. At least there is always some improvement.
Yeah.
And because you just help the body to improve their natural resources for healing, and sometimes doing very basic things with diet and exercise and lowering stress, that's tremendous help in the immune system and in general. So yeah. And now, well, a beautiful experience that happened to me is that, I've been like with 6 different neurologists, and none of them listened to me and explored my body in the way that I really needed to be explored. But I mean, mainstream neurologists, not alternative medicine neurologists. Those, yes, they helped me and everything. But I moved back to the city I used to live in, and I have my former doctor, not the first one I mentioned, but the second one. And the one that told me about my brain, that is like the clock is ticking for your brain if you're not taking that. But she saw me, she hugged me after 4 years without seeing her. And this time she just didn't tell me anything. She saw me so well that she just was very happy that I had improved so much even without her care. And she said, just continue doing what you're doing. I'm here to help you as much as I can. And she was super happy for me. Very, very empathetic. So I don't know what changed. I don't know if it was my attitude or her, but I felt heard by her for the first time. And she didn't give me treatment, but she listened. I had, with MS, we have like hyperactive bladder. And she asked me how was, she passed 3 COAs, 3 PROs. So I filled in for 3 questionnaires, and terribly validated, by the way. I didn't validate those, promise. I couldn't believe it. But in any case, I responded, and I said, nice, that I could fill in this. And then she saw the results and for the bowel and specifically, and she said, would you like me to send you to the urologist? Maybe, they can help you a bit and so on. And I said, oh, okay. She was listening to me for the first time, but she listened because I had filled in the patient-reported outcome. Not when I told her, when she saw it. And but what's the difference if I tell you or if I just tick it in a piece of paper? Well, it helped. So again, I have to thank my COAs for being heard. Yeah.
Miriam, you had your hand up.
Yeah, that's the thing. That's about the listening bit and the communication. I've been very reactive to that because I was on the other day, 3 weeks ago, I was at one of the big conferences for sickle cell worldwide, which happens in London, ASCOT. And they do patient parallel sessions. So they gather pharma, research, healthcare professionals, and patients. And the patient sessions run parallel to the whole conference. And then there is a presentation in the end to the whole audience. And so the patient sessions this year were about sexual health in sickle cell, which is a very hot topic that not many people want to talk about it. But one of the things that was, in the end, there was a nurse at the audience that asked specifically what can be done, what we thought. I answered it, but it was for the whole group of patients. Because junior doctors and junior nurses don't want to take on hematology and sickle cell because they think that the sickle cell patients are very difficult patients, aggressive, demanding, and a lot of stuff. And it's interesting. I could go on about that for a long time. The main thing is that one, it's an invisible condition which is triggered in hospital by severely painful crisis. So usually patients ask for strong medication to go with to control the pain first and then move on to whatever may be underlying. And that's not taken very well. And because there is a lot of, or there is very little knowledge when they arrive, especially at the emergency department, there's where the demanding bit comes from. Okay. And so fast forwarding a little bit, I said that there is a shared responsibility of lack of knowledge from the healthcare professionals, the very tight conditioning from being short-staffed, and time is very short. They don't have the time to listen properly, and they have so many boxes to tick. That's why I put my hand up right now. They have so many boxes to tick, metrics, statistics, and they only go through whatever they have to tick and they are responsible for, and they don't explore, and therefore usually they don't listen. And there's a work that has to be done, and I'm working on it right now, trying to find a way on educating the healthcare professionals on how to listen, because it's such a wide universe for sickle cell as it is for rare conditions. And each patient has a different story. And then, even for each patient, the crisis can be very different, which makes it increasingly difficult. So, if they don't listen, and if they don't listen to the fact that I've tried this and this doesn't work with me, and so it has to be in a different way, or other stuff, it's going to be it's going to go wrong, and sometimes unfortunately it leads to deadly situations, and there are patients that have died in hospital because they didn't receive appropriate care in time. The other thing is that patients also need to learn how to communicate effectively, and that's what I'm working on, because we are so taken by the pain and the disorientation and the fact that the people don't listen, that maybe we say stuff or we don't say the things in the right way, and that shuts the door immediately. So that's something I'm working on right now with my hematology consultant on how can we develop something that will help healthcare professionals on one side and patients on the other side to reach a good communication channel and to listen effectively.
Thanks for that. I think I'd like to return to that, but I'll go to Talita now.
I hear the experiences, and it could be me saying that I went through all that they went. Like when Noor said that the doctors would making her afraid of not choosing for one treatment, I was at the same condition, because there is a treatment which is hormone, it's gestrinone, it's an implant, and it's very controversial. There are studies showing that it's a good treatment, but there are other studies saying, well, it's studied enough, and it has a lot of hormones. It can be a steroid like testosterone, and you will have many adverse effects like acne. And I would go to these doctors and say, I don't care about acne. I'm in pain. I don't care if it takes 10 years of my life. If I don't have pain, I don't mind living 10 years less. If you're saying that this drug, this hormone will take my pain away, I will use it no matter the adverse effects. I don't care about acne. I don't care about my face. And they would punish me and saying you're doing wrong, you're destroying your health, like putting the weight of the decision on me, instead of saying, well, it's not the best evidence, but it has shown that for some time it can be good. I will stand up to you, and I will follow you and will be alert for the adverse effects. And if it starts to be too negative for you, and then we'll search for other alternatives. No, they would just, here, especially in Brazil, the doctors would divide into groups, the ones who were for and the ones who were against. And in the middle of this fight, they got to the point that they would prohibit the hormone in Brazil. And the patients started to going crazy about it. And it was like commercial stuff and ego stuff and academic stuff. And the patients were like just neglected at that point. And then they got another movement where they asked the patients to write their reports and post online. So they made a page especially for it, and they gather all this information and they took to the regulatory agency in Brazil. And then after going through all these documents and seeing, well, it's not as safe, there's not evidence of the safety as they claim, as one side claims, but on the other hand, it's really helping. So we're gonna open to reuse this medicine, but we're gonna incentive the study of it, and that's the point that we are now. So it needed to have a huge noise from the patients for it to become bigger. The burden was all going into the patients. And there is where I agree with Miriam and Nur, that Nur said, well, the doctor only listened to me when I responded the PRO. And so I feel like the PROs, they educate the doctors and they educate the patients. They educate the doctors because it translates something which is subjective, like symptoms and different words and how the person explains, to a symptom that the doctors are familiar to words that they are. And it creates kind of a checklist that will hold the attention of the doctor to what they need pay attention while the patient is talking. Also, gastrointestinal symptoms, cognitive impairment, well, pain. So I feel like discomfort. Oh, discomfort seems like pain. Check this box. And so, and if the patient didn't mention anything, the doctor will go through that PRO and say, well, and what about feeling this and that, this kind of pain in this side or that side? Or do you feel like you don't pay attention, or do you don't have that memory? It creates a checklist for both to guide the conversation and the listening between patients and doctors and healthcare providers, not only doctors, but all healthcare providers. That's where I am right now in passion with the PROs.
Yeah. And I wanted to ask, it's a really nice direction that the conversation's going in, because it falls in line with what I wanted to ask. I abandoned the topic guide, by the way. You might have seen that. But I'm interested in unmet needs in terms of awareness. What's the most, I want to ask each of you, what's the most important things, say the top 3 things that people should know about your respective conditions? An example of that is Letty having a work colleague, i.e. me, who thought it would be good to go walking for an hour and a half through Manhattan without much awareness of.
Yes, I remember that.
Yeah.
Yes, and in fact, I had a low glucose that day. I don't know if you remember that. Yes, well, the most important things about my condition, probably it would be to make a difference between diabetes type 1 and type 2. because there is a lot of confusion, misunderstanding, and people always is telling you things like, oh, but my neighbor just, I don't know, have cinnamon water and they get healed. And I'm like, no, I need my insulin, 3 or 4 times a day, so to make a difference between that, to know that we are very interested in being good, in feeling good. So we are not doing anything as a patient to damage ourselves, at least not in my case, but there is a lot of comments that come from, how to say this, probably not from a bad place, but people are always telling you things like you are not doing good enough to take care of yourself, without noting everything that you really do, a lot of 100, 200 extra decisions each day to keep you alive. And then you have to explain why are you doing the things that you are doing. That is from a patient's perspective. And then that, yes, we are capable of doing a lot of things. We are capable of working and being a parent and have fun and everything, but there are some days when you just need to slow your pace, and that you need that kind of, yes, empathy. Again, I don't know what else to say, but because I mean, I don't want to sound like a victim, but yes, there are some days that I need just to rest, to be quiet in pace. So probably that. And I just want to add something to what Miriam and Talita were saying about before. And I think that it is very important for patients and healthcare providers to act as a team, because we are not trying to make to take importance away from the fact that doctors have studied, that they are very smart and very into books and science, but they also need our perspective as patients, and it is all to complement, and to work as a team, because you need healthcare providers, you need a support team, you need family, you need friends, and all together is the only way to improve quality of life at the end, because it is not competing who knows more, the patient or the doctor, and there is where we need to to join forces, to say it somehow.
Completely agree.
And what about unmet needs with regards? I just saw Miriam, your comment about the fact that they leave important things out, the PROs, and I totally agree. I think developing PROs is a really fine balance, and it can't cover everything in a patient's experience. So I think we need to, but some PROs pretend that they do, and they just don't work in that respect. And what do you think are the most important things that are left out in sickle cell PROs, for example?
Oh, I don't know if there are specific PROs for sickle cell. Maybe there are a few around that, but they draw very much on what already exists for other diseases, and it's been growing more into quality of life more than just the pain, acknowledging that another important thing is fatigue, which is something that conditions patients very much, but fatigue is invisible. A lot more than pain, fatigue is invisible, but it conditions your life in every way. I wouldn't, but I think that when I am asked to fill in any PROs or any surveys, patient surveys as well, I always feel that it's not exactly to the point. It's like it scratches the surface. It goes for the the most common traits, and usually with other blood conditions as well, potentially, but it doesn't go specifically into sickle cell. And one of the things is that either it doesn't have patients in the design stage, or it doesn't have free flow texts. So I know the difficulty of free flow texts and analyzing them and digesting the information from the scientific point of view. I wasn't aware of that, but during this year, it was a learning curve. But there has to be a way to capture that and to include that, because that is essential, and that is the only way to give them more references and more symptoms and whatever to explore. You talked about unmet needs. Unmet needs. It's always a difficult with all the
I know
names.
it is unmet needs. I always stumble over that.
And I would like to say for sickle cell, and I'm mindful of the time, that's probably the main one for day-to-day life is standard and equitable care, including affordable solutions. So up to very recently, there was no cure. The scenario is changing with the bone marrow transplant and the gene therapy, and probably the gene therapy will be the solution, but it is very expensive. It's not available in most of the countries, and even in the countries where it is available, for example, the UK, it's very limited. So let's say that in the UK we are 17,500 patients, more or less, and it's available for 50 patients, so 50, with very limited eligibility conditions. So and this is like, we are very lucky to have it available, because in Portugal, for example, it simply doesn't get there unless it's part of unless it's part of a clinical trial or something, because it's very small market and it's very difficult to reach. I don't know how it works exactly, but that is a reality. So that's one. But the other thing is also more than just care solutions, more than a cure, it's more important to reach the solutions in terms of quality of life, as Leticia was saying. And that has to be with knowledge about sickle cell. In primary care, for instance, the relationship with GPs is very difficult, and they are our main door to stay out of the hospital and ensure a regular successful management of the disease, let's say. And unfortunately, many patients don't have access to a hematology consultant. They should have, but it's and even in the UK, not everyone gets it. Large cities probably. I'm lucky to be in Cambridge. People in London or Birmingham or Manchester, big cities, probably have one, but it's not guaranteed. If you leave the Western countries, then very difficult, and medication the same. So more solutions in terms of that. And finally, a recognition as an invisible disability, because it's not just about motor disabilities or neurological disabilities. There is a combination of limiting factors that contribute to that. And that means different access to support. And that is very important. Thank you.
So, and also, there's a lot of ignorance from just in general with sickle cell in people who are perceived to be white. So it's a big unmet need, and it's a big source of ignorance on the healthcare professional side.
But that depends on the geography. In the UK, that's a fact, because the vast majority are from African Caribbean origins. And well, I was born in Angola, right? Okay, so in a way, it matches. But the thing is that in other geographies, it's not necessarily, because I think it's related to the resistance or the higher resistance to malaria. But in Europe, it was developed around the Mediterranean basin, and also Middle Eastern, India, Southeast Asia. So there are pockets around. And in Portugal, for example, you have a lot of different, not so many dark-skinned people, lighter people, because it started a few generations back. And then people just get mixed, and so it evolves.
Exactly.
And that's the thing.
So you could be 5 or 6 generations down the line and you look completely white, but you've got sickle cell and nobody will detect it because of bias, you know. So Talita, what about unmet needs?
Well, in my opinion, for endometriosis and for most of gynecological diseases, the unmet needs are 2 types of PROs, one for screening and the other for follow up the treatment. Because a lot of ovaric polycystic ovaries disease, endometriosis, menopause, perimenopause, you could detect early the symptoms if you have a PRO designed to screen. And the earlier you detect, it would obviously increase the amount of diagnosis. It would be epidemiologically interesting because the more patients you have, the more interesting it becomes to the industry to develop new treatments, whatever kind of treatments. So if you have more patients, well, it becomes more interesting to invest in it. So the screening PRO would be essential, in my opinion. And it would be linked to following up PRO, because if you have a treatment, there are many options, and the doctors, I feel like they are in the dark, touching and going, trying and see, oh, it helps. Well, it helped for me. It doesn't help. Like, it's a much noise from the industry, from the patients. And if you have a PRO to start the treatment, let's do the PRO. And then 6 months after, let's see how you improve. And then you can measure the improvement with what really is meaningful for the patient. Like, did your pain improve? Did your sleep improve? Did your mental confusion improve? If you can measure the symptoms that are really meaningful for patients, then you can have more tailored treatments, even if they are physical treatments, physical therapy treatments, if they are natural treatments, if they are hormonal treatments. So these 2 PROs would make the patients to be listened to and would improve largely the quality of care and the quality of life of these patients.
So I'll follow up with that after No's unmet needs. No Ferrante Morales.
Well, with MS, for me, the feeling is that they don't diagnose you of MS unless there are visible lesions in the MRI. But that means that when lesions appear that are visible, it means that the illness is very much advanced, let's say. And there are other ways of detecting it and start treatment very early on. And also maybe use more PROs that are condition specific and that can, let's say, as a preventive medicine. And if you have some, I don't know, you suspect some symptoms in your patient of MS, or it's not clear, a PRO probably will help you clarify or at least direct things a bit. And then, well, right now there's an initiative that the PRO MS initiative, which is an international project directed from the Italian MS Association, and it's including patients all around the world and trying to come up with a PRO that it's really meaningful for patients. And so I really have high hopes with that one. And then for me, the biggest unmet need is the lack of information. you don't have information? Why don't you just give some, I don't know, even some flyers to the patient where it's simply explained what happens to you and also to the family and how to cope with this. And the complexity of MS, because it's unique for each patient, even though we share same common symptoms, there are a whole bunch of other symptoms that are unique for that patient. And to understand that you will need to learn your illness as if it were, let's say, a specific flavor and unique within that whole of MS, and that it takes time, and it takes time for you, and it takes time for your family to, or loved ones, to understand how the illness manifests in you. And then I would add maybe there is a lack of direct treatment, like they consider there is no cure. And when now we know that it's very much influenced by Epstein-Barr virus. And well, in alternative medicine, there is a tendency now to try to trigger those viruses and take natural antivirals. But they are not doing this yet in mainstream medicine. And for me, that's a huge lack, and something that I've discussed with the 6 neurologists that have treated me, and asked them, do we have something, to trigger the virus? Because if that's and there is a huge problem, because the main treatment is a immune suppressor. So if the problem is a chronic virus that you have there, mainly, that is like making the immune system go crazy and finally attack your own cells, but you are just destroying or targeting parts of that immune system, but you need it in order to keep those viruses at bay. You are just like, maybe you are improving in one side, but then if you get just the flu can trigger a huge, massive flare, because you don't have your immune system working, and it may not be destroying you as much in one way, but it's destroying you in the other, and making more small flares recurring, and it's a huge problem. And then all the viruses destroying you and growing more than necessary. So to me, that's like the biggest issue, and something that to me, needs to be really, really addressed urgently.
And so basically we need 2 PROs for endometriosis. We need but we need one for sickle cell. We need one for diabetes 1. We need one for MS as well.
Yeah.
So we need to get working.
Yeah, we do. We have to design them, get teams and sponsors.
Well, yeah, and the thing is, these things are it's all feasible as well. Taking it forward, it's feasible to do.
I want to share just one anecdote, if I have the time, and
No.
in relation to listening, and also a PRO that changed my life in a way that, well, it's very important. Well, in Spain, if you are you have sick leave for a year, you go through a medical inspection, and they consider if they give you disability, right, with the economic or financial support that comes with it. And well, I got to that point, and when I went there, the doctor just opened my file, and he saw the scoring of the different PROs that I had to fill in during the prior neurology consultations. And he said, I'm going to give you disability, absolute disability, that we call it here in Spain. And I said, what? and his disability for all work, for everything. And I just couldn't believe it. And in that case, the doctor was listening to me more than I was listening myself. Because I got there just dragging my legs. I couldn't even stand. I was with red glasses, earplugs, because everything, was aggressive for me. But I still wanted to keep working and having my clinic, my practice open. Even if I fell on the patients, I couldn't even stand. I wanted to it was like an absolute, let's say, negation of what was happening to me. And this man was able to listen, this doctor, and they gave it to me because of the PROs. So it was really, I don't know, a real shock. It was funny, at the same time.
Well, I think just to close, but first of all, when I'm working from a hotel room and when I went offline, it was just the hotel Wi-Fi. I got completely thrown off in terms of time, so sorry about that. I lost track of it. And the second thing is that I don't want to embarrass. I'm mentioning this because I know Letty and know best, but I've seen Letty, for example, having some really tough times, and she gets through it. She keeps working, and she finds strategies around that, and she raises a son as well, and so I can't I can't minimize the respect I have for Letty, given the adversity that she sometimes faces, as well as me dragging you around New York sometimes. And I know for a fact that when you were at your worst, you continued recruiting patients. You continued taking on projects. You were doing interviews while lying horizontal, not in person or remotely. That would have been a bit awkward. And you designed the linguistic validation course in the middle of all of this, the worst player that you had, and so respect to you for that.
Thank you.
And that's it. I think. Does anybody have anything to say?
Well, I would like to add something that Anna has put in the chat. She says, hearing all your heartfelt stories, just my 2 cents, please. I think real change in healthcare starts with listening, really listening, not just to respond, but to understand. I've seen a lot of doctors focused on diagnosing, which is their job, as we know, but sometimes empathy gets lost in the process. And when patients feel unheard, it affects how they trust the system. But I've seen also doctors who really listen, empathize, and just taking that extra moment to listen, I think can completely change how a patient feels about their care.
That's absolutely right. And it goes back to our first point about listening and empathy as the two main ingredients.
Yeah. Well, so I think we can close it here. And thank you so much to all the community members for being here and listening to us, really. It's very important, and at least to me, to have been heard. And I'm sure that for Letty, Miriam, and Talita as well. And thank you, Mark, for your precious questions and for listening with a heart. It's really very healing, and I really appreciate it. Thank you so much for being here, sustaining all of this.
Thank you, everybody.
Thank you.
Thank you so much.
Thank you for this space.
Well, and thank you to all those who have listened or are listening to our podcast, and see you in the next Linguistic Validation Cafe. Thank you so much for joining us today, and especially to our community of the Patient Voice and Linguistic Validation Cafe, since this is a joint venture and its creation is the result of all of us together. The Patient Voice and Linguistic Validation Café is an informal monthly gathering within the Art of Diversity training program, brought to you by Gibson Research Consultancy.